All right, and welcome to Birth Workers Without Borders. This is a podcast, episode 8, and we're going to be talking about boundaries and scope of practice as a spiritual person and a health provider with Dr. Laura Zelko, DC, which means Doctors of Chiropractic. So this podcast was created by Desert Bloom Collective because we are passionate about educating our communities through fertility, birth, postpartum, parenthood, and the rest of our lives. Today, we will be interviewing Dr. Laura Zelka, DC, and going deeper into knowing our limits and being clear about how or when our spirituality is embedded in our healthcare modality or influenced by it. And just so you know, you can find Dr. Laura or Nura's Instagram at Manzanita Mobile Chiro or website at www.manzanitamobilechiropractic.com. And it will also be in the description of this interview video as well. So our frequencies are reaching from El Paso, Texas, all the way to Oakland, California today to speak with Dr. Laura, who is an upper cervical specific chiropractor, as well as a mobile community chiropractor in the East Bay area. She is also a Muslim revert who embraced Islam in the same Muslim community that she currently practices. I got this quote from her website. She is fueled by a fierce desire to effect profound systemic change towards protecting human dignity from the womb to the tomb. And I'll be interviewing today. My name is Serena, and I'm a local licensed massage therapist and hijama practitioner, as well as doula and photographer. And Desert Bloom Collective, we are strong believers that families are free when they have full control over their own health and bodies. So without further ado, I am thrilled and honored to introduce my sister, Dr. Laura. How are you doing today?
Alhamdulillah, doing pretty good.
Yeah, thank you so much. Thank you so much for being here. I'm really excited to talk to you whenever we get the chance. I'm doing great. I'm actually excited to tell you that I'll be visiting Oakland in December, so I'll come give you a hug. It was funny when you interviewed me for your podcast. Some people thought that you were in El Paso, and so they were like, "Send my mom to your chiropractor friend," and then people's moms were like, "Oh, where's Dr. Laura?" Well, they didn't know your name, but they're like, "Where's the chiropractor that I need to go see?" And I was just like, "Oh no, who are you talking about?" "Oh, Laura in Oakland." So yeah,
Alhamdulillah.
There's people in El Paso if you're ever here.
Alhamdulillah.
But yeah, so if we could just start with the interview, I could go into one of the first questions. So what's a little bit of your background? How did you start into healthcare, and what have been some of the jobs, or what kind of healthcare have you provided?
So I started in high school as a volunteer at a hospice. So though I wasn't providing, direct, like healthcare, I was participating in the healthcare process by, making meals, taking people on wheelchair walks, reading to people, things like that. And then in undergrad, I worked as an HIV and STI test counselor at the Berkeley Free Clinic. Basically, talking to people about their risks for HIV and STIs. We did rapid tests for HIV, so giving results. And then I also started working as an in-home care attendant in undergrad. So I did that for 9 years. Again, sort of like, healthcare, like healthcare adjacent type of thing, like definitely more hands-on work, working with people with hygiene and showering and, things like that. And then I went to chiropractic school. So, and then I graduated chiropractic school with a DC, Dr. Chiropractic, and that's where I am now.
Alhamdulillah, congratulations with all of your success over the last few years. And yeah, I know all about your in-home care that you provided because you also got me into that when I was in Oakland with you. And how did all of this work in your background kind of like inspire or shape like you going into what you're doing today?
So specifically, I think that my role as an in-home care provider had a lot to do with my choice to become a mobile chiropractor, because I remember how um,
Can you say
when
that again?
people,
It cut out. I'm sorry.
oh, oh yeah, no worries. Um, I remember how difficult it was for some of my clients to get out to appointments on a regular basis. And so, specifically wanting to work with, the disabled community and make sure that I was able to make chiropractic care more accessible, easy to access. So that had a lot to do with it. And then I think, I've always wanted to be a healthcare worker, like since I was a little kid. But I think I was a little disillusioned with like the medical establishment. And I realized that I wanted to have a certain amount of autonomy, and that if I wanted to have the amount of autonomy I wanted in the medical establishment, that would have been a really difficult road. And so I decided to basically just try chiropractic school. It was kind of an interesting story of why I even ended up applying to chiropractic school, but it ended up being the exact right decision. Alhamdulillah, Allah is the best of planners. And so, yeah, I guess that's kind of, hope that answers your question.
Definitely. So going into the topic of boundaries, scope of practice, how do you protect your own boundaries in this work?
So something that I noticed when I was an attendant is that not as maybe a little bit about spiritual boundaries, like maybe, ending up in situations with clients that made me slightly uncomfortable, things like, other people's religious ceremonies, or like the time that I had a male client who needed hygiene care, and I kind of had to negotiate, whether that I was the right fit for that job. And things like that. But so that was kind of like my entry into understanding like boundaries and how important they were. And then with chiropractic, when I got to chiropractic school, I noticed that there was a sort of subset of my classmates and later colleagues who would also, in addition to providing chiropractic care, would also purport to be spiritual healers of some variety. And, some of them I have no doubt, and others I had some doubts about, the authenticity of like, the chain of teachers that they were learning from. Some of them, it seemed like they just kind of got stuck in a cult, the whole spectrum. And so I kind of it became like really pertinent to me to have to be able to set boundaries for myself, knowing that, like circles and encompasses everything that we do. And so the way that I have tried to negotiate boundaries in my practice is that I think it's kind of like a couple fold. Like one thing is just like regular old boundaries, like, having a separate phone line. Because I have had in the past patients that were also friends, or patients that were also, sisters in Islam, that I had their number for other reasons. And so, like getting a call from somebody and it's not during office hours, and I pick up the phone and, be like, oh, hey, you want to take the kids to the park? But it was really about, oh, I need to reschedule my appointment or something. And I realized like, oh, okay, well, this is a small issue that could end up a big issue later. So just making sure that like my office hours are separate from my personal hours, my office line is separate from my personal line, just basic things like that. But then like spiritually, making sure that people understand that I am not a sheikh, I'm not an Islamic scholar, like I'm a lay person when it comes to Islam, and that, if a person experiences what they perceive to be spiritual healing in the process of chiropractic care, that like, I am not doing that. I am not saying that I'm doing that. And I feel like other people could have other boundaries, or they might have other ways of dealing with that, that are true to them. But for me, it seemed really important because I'm very nervous about getting caught up in claiming to do more than I should. So that's kind of how I have negotiated boundaries, both like just regular old doctor-patient boundaries, and then also like with the spiritual aspect of it.
Did you ever run into issues with like you were trying to practice gender separation in school or with clients after getting your license?
So I mean, the short answer is I do see male clients technically. I don't have any at the moment, but I'm open to the possibility of seeing male clients. But I'm sorry, I didn't realize it was going to mute if I got a phone call. So I do technically, I would be open to seeing male clients, but since I am mobile, I have to be especially careful with, which ones I would pick. My rule is basically that like, they have to be a referral from someone I know, and we have to have a female in the house while the appointment is going on.
Yeah.
So like, I don't mind seeing a male patient, but I'm not going to be in a man's house by myself. That's beyond my boundaries.
And in your, oh, sorry.
I know other people have, different boundaries based on, their, their worldview, or like how they practice their spirituality, either Muslim or non-Muslim, but that's just, for me, there's just like too many factors.
And your plan is to pretty much always practice with mobile in your name, to be going to people's homes, correct?
Yeah, I mean, that's the plan for now. I wouldn't mind the idea of having like a spot that I also use maybe part-time, like a location, but still keeping the mobile aspect as well. Cause I think it's really important to be able to meet people in their homes.
Definitely. Do you do like extra charge for that, or is it just kind of part of your work?
I do for like a certain amount of miles away from my house. I have like a little extra surcharge, just like for gas and time. But other than that, yeah, it's kind of just folded in.
Do you, I'm just curious for my own business, because I also do mobile still and have a location. And I guess having a location, I got a little bit like, oh, they need to come to me now, or something. And so I do charge a little bit more. And but I understand, like, for example, we just have stairs to go to my room, so that isn't even accessible to people. To people with wheelchairs or whatever, or struggle getting upstairs. So even pregnant people. So I definitely look into still try to do mobile massages and services if that there's a health reason. But yeah, I was just gonna comment too, from massage school. I think I was a little bit late on realizing, maybe for me, that I've decided to not touch the opposite sex for massages, to not take my male clients. And that was part of my husband becoming a massage therapist too, and kind of filling in that space of all these different people who would call or be male clients. And alhamdulillah, it was just so liberating to finally have like a Muslim friend kind of tell me like, hey sister, like, just so you know, maybe you shouldn't massage men if you're Muslim, just like you're by yourself and touching them, like in this way. And it just like clicked for me and Chris, like, yeah, like I knew it was kind of like not right for me, but the school and the culture of massage and this country just kind of, I think, influenced me while I was a student to not even think that I could do anything about it. Like, oh, this is just how it is. Like, there's no way around it.
Or
But
that you're the weird one, like you're the weird one
yes.
for not wanting
Oh,
to.
yeah. The first
Yeah.
Muslim ever to be in the program, basically. So
Oh
it's just
yeah.
like, yeah. So I'm just like, ugh, like so much fighting, you know. But it ended up, alhamdulillah, being good for Chris to try that out when he went, and we've already kind of been through this whole change with my business. So anyways,
Alhamdulillah.
I'm like hearing you and like, oh, all these things I need to do better too. So mashallah, you have a really good way of talking about your boundaries and, you know, putting that into practice in your life.
Alhamdulillah. I
Yeah.
was just gonna say about like seeing the difference between like massage and what I do. Like part of the reason that I really like what I do, because one population that I like really want to work with is formerly incarcerated people, men and women. And so like one of the things that's kind of cool about upper cervical specific chiropractic is that, I mean, cool for me, maybe other people would not say that because they want something different, but there actually is not a whole lot of touching compared to like your average chiropractor.
Mm-hmm.
So like the level of physical contact that I even have with a male patient is like pretty minimal.
Mm.
Um, with the exception of just like, you know, the initial exam when I'm like, you know, telling them, oh, push your muscle down. Okay, push the other one. Um, and so that, you know, that makes me feel comfortable. But yeah, massage is a whole other story. Whew,
Yeah, more intimate for sure. So how do you balance the relationship with a client? I know you talked a little bit about your phone. That was a really good example, but that client friend, I guess, client community relationship, and especially being mobile and how much time goes into conversations at their house and things like that. So how does this play out with the community, sir?
Well, I mean, I really just have to be really upfront about communication. And, you know, it's easier to do when I already know somebody. And, you know, especially if somebody knows that I really prefer direct communication and just sort of like having things be plainly said. Um, you know, that it makes it a little bit easier than even with a patient that's, you know, like a sort of acquaintance or like a friend of a friend, friends who are clients or family that are client or patients. Then I basically am just like, hey, so, you know, HIPAA still applies. Like, you know, if people ask me, you know, I don't, you know, I'm not going to tell them that you're my patient. If you choose to tell other people that you're my patient, then that's up to you. You're totally welcome to do that. You know, once that happens, then, you know, obviously we can be more open about like, oh, you know, she's coming over to whatever, this and that. But you know, that like just because they're my friend or just because they're in the community with me, that like they don't lose any patient privileges, and that like I will still keep, you know, their identity and their case details completely anonymous and confidential. And then yeah, just being really honest about like I really love hanging out with you, so just telling people like it's difficult for me to leave your house because I know like we could just sit here and drink tea for 2 hours, but I can't do that. And so like text me on my number, and you know, whether it's during office hours or outside of office hours, text me on not my Manzanita mobile line, text me on my regular phone, and we can go to the park with the kids, we can try to plan dinner, you can come over sometime, like, but like we're like this time is has to be about, you know, like how your health is doing, getting your scan, adjusting you if you need it, resting you, which means you can't be chatting with me while you know, while you're resting, like you actually need to be resting. um, and then, you know, like once that time is over, like I need to go. And it's not because I don't want to hang out with you. And just sort of like making it super obvious to people so that they understand that, you know, it's not personal. It's just that like, again, boundaries. I have my protocols and I have to stick to them.
Mm-hmm. Yeah, I just was working with a woman from Iraq yesterday, and it was I think just because of English in general, like not wanting to fill out all this paperwork and stuff and read everything. And so at first I'm like, sure, we could do this different and you don't fill out any papers. Like I was so confused, like what to do. And then finally it was just like, okay, I'm going to ask you every single question and help you fill this out, but I really need you to have a chart. And it's like, okay.
Yeah.
It worked out. I'm doing that.
Alhamdulillah. Yeah, that can be difficult too. It's like, oh, can't you just?
Yeah.
It's like making it clear to people that like, my protocols are for, your safety, for your, experience, for you to get the absolute best care possible. And, even for like the worst case scenario of like, what if you get in a car accident and, you need to prove to some lawyer or something that you didn't have debilitating migraines before and now you do. They're going to want my records. And if I don't have them, I can't help you. It's not about me like trying to protect myself from my friends suing me. It's more like making sure that everybody's just like covered in general.
Both sides, right? That's
Yeah.
like the importance also of like why you even have like a contract when you have your own business, just even if you're a friend, just helps.
Yeah.
Okay. How do you negotiate the relationship between spiritual healing and physical healing?
So yeah, this kind of goes back to like what I was saying before about my discomfort in school with kind of how like certain tendencies or like certain individuals even in chiropractic at large were sort of meshing the two in a way that seemed either disingenuous or even like bordering on potentially manipulative. And so the way that I do that is again like mostly just through direct communication with people. Like if it comes up, then I'll be like, whoa, like put the brakes on. Like we all know that Allah is the one that's in charge of all of this. Like I did not heal you. First of all, like your body healed itself, but that's only because Allah built our bodies to heal themselves. That's the deal here. And then mashallah, and then also just sort of like I don't claim to have any sort of like special relationship to that process beyond the fact that like I trained really hard to deliver adjustments that clear scans and remove interference from the nervous system, which again is all laws that Allah set up. And then that I make dua for my patients, but like that's just like anybody else making dua for somebody that they know is going through chronic health issues, making dua for them. It's so that's kind of how I negotiate it. I don't really try to like, I guess I don't try to put it like as front and center. Like I do like, I like, obviously I'll say like Bismillah when I walk into people's houses, I'll like be doing Fatiha in my head when I'm like setting up my table before I adjust somebody. But I'm not, I guess like, it's kind of like a more private thing. I'm not as much sharing that with the patient for the reason that I don't want them to get the wrong idea because that's just kind of the way I choose to do it. But again, like I know other people do it totally differently and manage to walk a different line that is still like very honoring and is not, a manipulative or anything like that. That's like really empowering. But I think it's just important for people to know that like that you do have to think about that. Like you have to really be interrogating yourself as to like the choices that you're making about, how you express your spirituality as a, in a it's a power differential. As, somebody who is acting on another person's body, like there's a power differential there. And so like, I just, as part of like my sort of political analysis, like I need to try to like balance it the best that I can.
And going this whole topic, boundaries and scope of practice as a spiritual person and health provider. Is there anything else that you would like to speak on? I was going to ask you your scope of practice, but I think we've kind of heard it throughout as well. But is there anything else like that you could think of that would be specific to talk about with this topic?
I think all I would do is I would just sort of like say to people who are in the healthcare world, especially in like the wellness world, that's not the like medical world, but the rest of the rest of the healthcare modalities, of which there are so many, just to like be really intentional about how you are using that power differential as the person, work acting on another person's body, and how that intersects with like spiritual power and, and I guess I don't assume that like the vast majority of people are out to like be spiritually abusive, but that is a problem. And I think it's a problem that people can actually accidentally fall into without intentionally doing it at first. And then the power feels good, and then it kind of gets more intentional. But just like being like consistently self-critical about the ways that we engage with our patients or our clients around, the unseen, and other like spiritual dimensions that can really like influence a person's the way that they navigate the world. And then I would also, just on the other side of that, I would say to like patients and clients, that like if you ever feel like somebody is using, your spirituality or their spirituality or your shared spirituality to, like abuse you financially, or, God forbid, physically or sexually, emotionally. If you ever feel like that icky feeling inside, like it's okay to run, like it's okay to get out of there. And that there are other people out there who, like, not everybody is like that, and there are other people out there that will be a safe place for you to like continue your healing path.
Yeah, like just today, I'm not trying to talk bad about Reiki or like any type of like different spiritual practices that I do or don't do. But a client was like, "Oh, was what you were doing on me earlier like Reiki?" And at that point, I'm like, "Oh no, I can refer you to someone who practices Reiki, and I'm happy to do so." But I mean, I do pray in my head, like in general, for your overall healing while doing a massage in general. That's what I do. And I call it just like light healing, or I don't know. There's like not really a word for it in Islam, like ruqya, like actually reciting verses and, putting your right hand on someone. For hijama, we do that. But yeah, I'm just like thinking like all these different boundaries, like it is very specific. It just totally depends on someone's, I know people that would even, they're like, "Oh, you're this religion, I'll pray to your God, for you during this session." So there's all kinds of ways that you can do all kinds of things. And yeah, I definitely love working with clients of all religions, because it's like seems like sometimes clients are attracted to my business for being Muslim because they also are kind of like, "Well, what is Islam too?" So it has been an opening, to talk about things spiritually and even find out maybe like more intense things that someone's going through when you do talk about the spiritual. But yeah, thank you for sharing so much on all this. And I wanted to go a little deeper on just talking about your ideas, or, how it would be possible to support people who you said formerly incarcerated, who are currently incarcerated.
Oh yeah. So I mean, the long-term plan is would be to be able to get upper cervical specific chiropractic in prisons as like regular healthcare.
Like a clinic day, like they kind of like come in a line and that kind of thing, or like,
Well, so there, a short answer, no. Like as like an actual, like, I would come, or whoever would come every, couple of days and like be there for 5-6 hours and see our patients and then leave, like having like an actual sort of roster of ongoing patients who are being seen for the same things that they would be seen for out here, migraines. A lot of people find a lot of good results for things like anxiety and PTSD, vertigo, obviously like neck pain. And, there's things that, upper cervical specific chiropractors are kind of known for having a lot of patients with that because they see a lot of results. So being able to see people inside behind the walls with those same issues. But in order to do that, it would probably be a pretty long process that would probably have to include like some formal research studies and like formal like conversations between like prison officials and probably an organization, like a chiropractic organization of some variety. Because I don't think like me just going up, in there with like with my little hijab on, like, hello, I would like to do research. Like, I don't think that's really how it works. But in the meantime, focusing on people who are coming out with, severe trauma, physical and mental, and having not been adequately treated for anything that they may have may have like, I guess, just have been dealing with for, up to like 30-40 years, and just having your entire existence be sort of predicated on the fact that like just straight trauma day in day out of all varieties. And so that is the sort of shorter term vision, is to be able to take care of formerly incarcerated people and give them like a better chance at reentry, because it's a lot harder to reenter society when you've been, like medically neglected for 20 years.
So even when they come out, you're there also as a resource, not just in jail, but when they come out, like that continuity of care.
Continuity of care.
And then, maybe also community at that point, like connections and people, stuff like that. That's beautiful. And not to like, oh, are you going to get paid for something like this? But like, is this kind of dream something that would be like government sanctioned or like grant money, or is this something that would be like, this is my volunteer work in my life?
I mean, I'm not sure. I guess I don't even know how at this point it would work as far as like inside the prison logistically, but outside, yeah, I mean, I would prefer to get paid, but if I don't, then it is what it is.
Right.
But I do feel like there are enough, there are enough grants and, nonprofit organizations and people working on reentry that if I can basically prove that what I do is a great benefit to people reentering, that I could get some sort of stipend for it, which obviously would be, it would be nice to have that, because, making rent is good.
Exactly. Well, I know that, I don't know if they're the same name, but when I did my doula program in Oakland, it was like one of the organizations that was trying to get people into the doula program, and a part of it was the Birth Justice Project. And I know that they help with birth in as doulas in the jails. So they've always been on my mind of like, oh, because I also want to do, birth work here in El Paso in jails. wherever I live as well, like same passion. So alhamdulillah, but it's like, I see it definitely more of a reality and easier in the Bay Area than in a place where maybe people don't even see prisoners as somebody to, why would you volunteer? You know what I mean? Like, why would you help support prisoners is kind of probably the more the perspective I might get here. So I feel definitely like that's totally a reality in the Bay Area. I know that there has to be the right connections, and yeah, I wish all of the beauty and prayers towards that project. I know it will happen if you really want it to. So inshallah. And I did want to ask you, I read some cool information on your website before this interview about the Manzanita tree, but instead of just reading the paragraph from the website, I just wanted to hear your own story behind why is the tree in your business name?
Okay. Well, so I mean, first of all, it's like my favorite plant. But there's a reason for it being my favorite plant. So the two big reasons are that, like, first of all, I have spent pretty much my entire life on the West Coast, where manzanitas grow. And so to honor the people whose land I've been a guest on for pretty much my entire life, and like how important manzanita is to them, I wanted to name my business after it, to sort of root it in a place and also pay homage. And then secondarily, the cool thing about manzanita trees is that, or bushes, is that they are incredibly adaptable plants, in that, like, they can survive, fire seasons, which, we have here. And obviously the kinds of fire seasons we've been having recently is because of a lack of indigenous stewardship over the land. Is not usually how it goes. But fires are normal here, just not on this like incredibly massive and devastating scale that it's been every year. But the manzanita trees or bushes can survive this very harsh climate situation of like regular fire. But the cool thing is that they actually don't need it. So it's not like, because a lot of people think that like they need fire to live, but they actually don't. They're just capable of dealing with it. So the kind of metaphor behind that for me is that, like, I want that for my patients. Like, I want my patients to be able to adapt to whatever life throws their way, whether it is easy or difficult, with a well-regulated nervous system. So yeah, that's why manzanita.
I love it. Well, I feel like I've gone through all my questions. Do you feel like that was a pretty good time that we spent together today on this topic?
Yeah, I mean, I guess I want to specifically, because I was kind of like vague about it before, but like the two groups of people whose land I've lived on was, when I was growing up, I was living on Shumash land, and now I'm living on Ohlone land. So like specifically, those are the peoples that I'm like, that I'm trying to show respect to. And
thank you. I was going to ask you that and I forgot. So thank you. And okay, so I just wanted to reiterate that you can find Dr. Laura Noura's Instagram at Manzanita Mobile Chiro, or www. The website is manzanitamobilechiropractic.com. So this has been Birth Workers Without Borders, episode 8. And thank you so much for being with us today.
Thank you for having me.
I can't wait to see you in person. Okay.
Yay. All right. Assalamu alaikum.
Walaikum salam.